CT practical questions. 75 questions. Interview based. Also for refreshing CT knowledge. Why is a venous line always used to give contrast for a CT scan? Why not arteries? Why do you have different Hounsfield units for different organs in the body? What is the major difference between a CT scan and an X-ray? Why do you use different flow rates for different phases in a CT scan? What are the different phases in the CT scan? When you see images of a venous phase of an abdomen, how can you say that it's a venous phase just looking at the images? How is contrast administration in CT measured? And what is it based on? What is extravasation? How is it managed? How much radiation does an abdomen pelvis scan have? Which has more dose, usually CT brain versus CT abdomen and pelvis? And why? Why do you do a delayed phase in a CT urogram? What are the major arteries present in the brain and neck? What is pneumothorax? What is pleural effusion? What is hemothorax? What is emphysema? What is pericardial effusion? What is pneumoperitoneum? What is AAA and aortic dissection? What is HCC, RCC, and TCC? What are bleeds and what are the types of bleeds in the CT brain? What is the difference between volume and helical scan? What is CT contrast made of? What is the difference between different types of CT contrast? Why does CT contrast appear radiopaque in the scan? What are the major arteries in the human body? What are the major veins in the human body? What is eGFR and what are the normal values? What is the difference between HRCT thorax and the normal CT thorax? What is the difference between an abdomen window and bone window? What are ERMER guidelines? What are lymph nodes? And why is it that the arm which has had lymph nodes removal avoided for cannulation? What is MPR? What is buscopan? And why is it used for a CT virtual colonoscopy? Which is the most common site of cannulation? And why so? What are the different phases in CT scan? What are the different cannulas we use for different phases of CT scans and why? Why is it important to check for diabetes and metformin tablets before CT contrast injection? Why is saline used when administering CT contrast? Why do patients feel a warm sensation commonly when CT contrast is administered? How expensive is a CT scanner? What are the different windows used when acquiring and viewing CT images? What are the different contrast triggering anatomical landmarks for different arterial CT scans? What are eGFRs? What are its normal values? Why is it important to check for eGFRs before CT contrast administration? What is SEMAR? And what are metal artifacts in a CT scan? What is calcium scoring? Why is it performed in a CT cardiac angio? What is the timing used for a portal venous phase and what is the importance of it? Explain the circle of Willis and its anatomy. Explain CT contrast physiology from administration to excretion broadly. What are the types in which CT contrast can be administered and what are the difference between them? Can lower leg and foot be used to administer CT contrast? What are the main indications for a CT brain plane? What are the indications for a CECT abdomen? What are the indications for a CECT thorax? What is CT virtual colonoscopy? Why and how is it done? What is NICE guidelines? What are the types of CT contrast reactions? And how is it classified? How is CT contrast reaction managed? What is IHD and CAD concerning CT coronary angio? What are CT numbers? What are the major bones present in the skull? What is GCS? And what is the clinical importance of it? What are the differences between different slice models of CT scanners? E.g., CT64 versus CT128? What is the radiation dose unit of CT? And what are the average dose values for different parts? For example, brain, abdomen, and pelvis, extremities? What is Stoke and window period? What is its importance concerning priority in a CT brain? How is the volume of the CT contrast decided based on the part of the body being scanned? What is the difference between oral and fore contrast in CT? Which are the fore and oral contrasts used? What is pitch and rotation time of the X-ray tube in a CT scanner? Why are arterial scans performed? What are the types of artifacts seen in CT? Are arteries opacified in a venous phase of an abdomen? What are the different CT numbers of different organs? Why do some abdomen portal venous scans appear arterial despite the usual time delay post-contrast? What are the indications for a CT cub? What is the importance of a contrast-enhanced scan compared to a plain scan? What is a hernia? And what are some of the hernias seen in a CT abdomen and pelvis scan,